Obstetric fistula. An obstetric fistula is a serious medical problem that can happen when a woman has a very long and difficult birth. A fistula or hole can form in the vagina where the baby's head has been pressing in the birth canal for too long. If a fistula happens, it is not the woman's fault. A fistula can form if a difficult birth happens without good medical care. The fistula can be between the vagina, birth canal, and the bladder, where urine is stored, or rectum, where feces is stored. Young women who live in poor areas and are far away from hospitals are more likely to suffer from this problem. It is even more common if girls are pressured to marry too soon and have children at a young age. Birth is more dangerous, for both mothers and babies, if the mother is too young. A fistula causes leakage of urine, or feces, from the vagina. This can cause a bad smell, rashes, and infections. Having a fistula can make daily life difficult for women. They can feel alone, sad, and low in mood. Support is needed from family, friends, and community and healthcare workers. If it is not treated, fistula can cause more problems like infections, not being able to get pregnant again, and not having monthly periods. In the worst cases, it can even cause death. A fistula can be treated or prevented. A catheter, small tube, can be put into the bladder to give it a rest after difficult birth. This can stop a hole forming, or help it to heal. Your healthcare worker will explain for how long this tube is needed, usually days or weeks. Later on, if needed, an operation can be done to close the hole. This needs to be done in the right hospital, with specially trained healthcare workers. Healthcare workers and communities can support you. They can help you with a healthy diet, exercises for the pelvic floor, and recovering after surgery. They can support you with your mental health, healing, and getting back to a normal life. In some countries around the world, fistula no longer happens. We need to talk about it more, so fistulas are prevented. To help prevent fistula, wait until you are an adult before you get pregnant. It is much safer for you and your baby. Plan your pregnancy and use contraception until you're ready to have a baby. When you are pregnant, go to all your pregnancy checkups. Trained healthcare workers can help you have a safe birth. This is even more important if you are young or a teenager. Sometimes, if there are problems in labor or the birth is taking a long time, a cesarean section may be needed for the safety of mother and baby. Remember, a fistula can be prevented by planning a safe pregnancy and birth. If you think you might have a fistula, see a healthcare worker. It is not your fault, and it can be easily treated.